Delighted to be here and be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. I'm Grisel Rodriguez Morales, Rush Generations Program Director, and today is Wednesday, January 22nd. And as we are in the beginning of the new year, we are discussing today how we can prioritize our health and well-being. And we hope this conversation encourages reflection and meaningful goal settings, and that you learn practical tips for prioritizing your health and your values for a fulfilling year ahead. I'd like to start first thank our producers, Franco Zambataro and Hannah Weitzman. I'm going to be introducing our speakers very soon. But today, Franco is going to help us manage the chat and other key aspects so that we all can have a great discussion. As you know, these lectures are live streamed via our YouTube channel, where we have dozens of other health education lectures that you can always refer to. But also you can let friends, family, and colleagues know about this channel. And when there's a lecture you've enjoyed, please share it with them so that they can also benefit from the valuable information that our speakers offer every other week through Rush Generations. And you can always subscribe, and that way our lectures will be at your fingertips. We also usually have a good number of people joining us via phone. And at the end of the lectures, we give them an opportunity to unmute your audio and ask questions. But for those of you on YouTube, we ask that you please use the chat function to ask questions, to add to the discussion throughout the lecture. We will make sure that your comments and the questions make it to the presenters. As we always like to remind you, the information that we provide here is usually for general informational purposes only. So for those instances in which you need something that is very specific to you and to your needs, we recommend that you seek additional professional advice. We're just delighted that you're here today. And without further ado, let me introduce our speakers today, two great geriatric fellows here at Rush. I'll start with Joel Solis, who is originally from Southern California. Joel Solis is a geriatric fellow at Rush with interest in transitions of care and palliative medicine. After completing medical school and residency in Los Angeles, he completed a palliative care fellowship before his current geriatrics fellowship. Outside of medicine, he enjoys watching sports, doing karaoke, and also he enjoys U.S. history trivia. Then we'll have also Leonardo Marty Roy. Dr. Marty Roy is a Canadian, Italian physician and grew up in the Dominican Republic. After completing medical school there, Leonardo finished internal medicine residency at Rush University Medical Center with us here in Chicago, where he is currently continuing his training with a geriatric fellowship. And outside of his medical career, Leonardo enjoys sports, particularly playing soccer and playing the guitar. So thank you, Dr. Solis and Dr. Marty Roy, for joining us today. I'll have then Franco help us transition into your presentation. Let's see. We are still seeing, okay, perfect. That's it? Great. Thank you, Franco. Go ahead.
Hello, everyone. Thank you for joining us today. And thank you as well for the introduction. We'd like to talk to you all a little bit about what matters in the new year. Our objective today is to kind of provide some tips and tricks, some advice as to how you can take control of your health, work with the healthcare system to be able to achieve these goals and continue making further goals for the next years as well, okay? So can we get to the next slide, please? And this is our agenda for today. We're going to split them amongst the two of us. We're going to start off with the 4 M's of geriatrics, followed by SMART goals, discussing goals with the healthcare team, and then we'll discuss advanced care planning as well. Next slide, please.
Okay, so we're going to start off our conversation with talking about the 4 M's of geriatrics. Next slide, please. So what are the 4 M's of geriatrics? Basically, to kind of start off with, we know that care for older adults can be quite complex, especially those with chronic diseases who are using, going to clinic a lot, going to the hospital a lot, being really involved in hospitalizations, especially in transitions of care, which is why I have a big interest in it. The 4 M's of geriatrics basically consists of a framework to care for the older adult in a way that makes sure that we as geriatricians are addressing these 4 M's to make sure that we're really optimizing the care for the older adult. We'll go through each of them individually, and I think what we really like to point out here is that even though there's 4 distinct M's, they're always overlapping with each other. And so when we're talking about one, you have to make sure that we're also being mindful that the other 3 are being involved and how they're always in interplay. So like I said, a lot of moving parts very frequently, a lot of complicated things going on. And so this is just a general framework to make sure that we're addressing all these concerns and all these things that really impact the care of an older adult. So basically, we'll go into them right now, but this is just a picture from UC Davis. It's mobility, mentation, medication. And the last one, which we'll be emphasizing today, is what matters. Next slide, please. So first one, we'll briefly just talk about as an introduction, mind. So this involves discussing the mental well-being, including cognitive impairments and any other things that are going on when it comes to our mental well-being. It does involve not only identifying these changes, but also making sure that we address them. And so, like I said earlier, this is one of the M's. And when we talk about how that impacts other ones, we think about how our mental well-being, how maybe if there's any cognitive impairment, how they may actually impact mobility, what matters to us, as well as is this being addressed through a medication, or what we also see, is this the cause of a new medication or stopping a medication? And so just to give an example of how they're always at play. Next, we have mobility, which is the second M of geriatrics. This involves, making sure that we're really maximizing mobility. The more we're able to move safely is better for everybody. And again, just to kind of get at how it's always at interplay, we want to make sure that this mobility is allowing us to do things that what matter. So there's a big connection between mobility and the mind. And on top of that, when it comes to medications, just like with the mind, we talk about, is our mobility being compromised by too much of a medication? Is it being compromised by not enough medication? Is it compromised because we need more, or more medication, or we stopped one too early? These are things that we always have to be considering when we're talking about mobility. So these are 2 of the M's. We'll talk about the other 2 on the next slide, please. Medication. So this is a really big one in geriatrics. Dr. Marty Roy and I were always making sure that we're addressing medications in clinic, and really all geriatricians do this too. So it's really important that we are reviewing every medication at every visit. Oftentimes, what we have in our system is not what you may be taking, or if you're at clinic with someone else, what they're taking as well. So having said that, please, we always want to make sure we're going over medication so that we're all on the same page about the medications we're taking, the dose that we're taking, the frequency that we're taking. If there's any concerns about medications, we bring them up at that point. And so not just reviewing the medications, we also want to make sure that we are discussing prescribing medications, or, the process of what's called deprescribing medications, where we're trying to take away medications. This comes up a lot in our visits. A lot of people feel very strongly about trying to reduce the number of medications they're taking for one reason or another. And so all these things are at play when we're talking about medications. And then, as we kind of talked about earlier, we want to make sure that these medications that we're taking are not interfering with what matters to us. It's not affecting our mind or improving our mind, I should say. And we want to make sure that's also not affecting mobility. And so ideally, if we're taking a medication, we know why we're giving it, we know why you're taking it, the dose, the frequency, like I said, making sure that we're really optimizing your overall care. So medication is a big one. And then the fourth M, and the one that we'll spend the bulk our presentation on today, really involves understanding our health goals and our values. And so making sure that we, say we as patients, that we think about, what's important to us, our values, making sure that such conversations with the doctors in clinic or the healthcare team, wherever we may be interplaying with them, that we're documenting such conversations as well. What we like to tell people is that, right now where things are going okay, that's wonderful. We want to keep doing that way. And at the same time, we want to make sure that there's a plan in place in case of an emergency. And so we also want to make sure along the same lines that we're ensuring that the plan that you're receiving is in line with your goals, your preferences, your values, and making sure that they're always in sync with each other. We've seen it a lot where such things will not happen. And so we want to make sure that we really stress some of that throughout our conversation today. And so that's the one that we'll be focusing on today, on really what matters to us. Next slide, please.
All right, so next I will be speaking a little bit about SMART goals. Next slide. So SMART is actually an acronym, and it stands for specific, measurable, achievable, relevant, and time-bound. And so it's an acronym that helps and reminds us how a goal should be formed or how it should be created. So specific means, it's clearly defined. It's within certain criteria. It's very detailed. There's no ambiguity. It's precise. Measurable means that you can monitor progress. You can check for milestones, and it's usually described in very specific terms. A goal should be achievable, right? You want it to be realistic. You want it to be reasonable, and it should also be relevant, right? So not everyone will have the same goals. It's going to be a goal that should be individualized to you, and it should matter. So that fourth M here again is important, right? It should be relevant to you. And the last one is time bound. So you want to set a timeline. I don't like the word deadline so much because it's very harsh. I think that it's good to have a timeline, an idea of how things will be taking place, when things will be happening, not necessarily a deadline. Sometimes the deadline can change, and that's okay. So if you set a goal, for the next 2 weeks, you want to accomplish, say, X, Y, or Z thing. It's okay if you do it in 3 weeks, right? It's not a deadline that will determine whether your goal was achieved or not. But it's good to have that structure. Next slide, please. So how do we make a SMART goal? So if I were to say, my goal is I'm going to improve my overall health. Dr. Solis, would you say that that's a pretty good goal?
Sounds great. I think you're just missing a couple of things.
Yeah, so it is a good goal, but it's not a SMART goal, right? So here on the slide, we have a couple of things that you can maybe think about when you want to improve your overall health. So maybe you'll think about your sleep hygiene, about nutrition, about eating healthy, about exercising, and maybe increasing the amount of physical activity that you're doing, stress management, drinking plenty of water, staying hydrated, and then preventive care. So these now are a little bit more, I guess, in-depth details about your overall goal, which is good, but it can be better. Next slide, please. So if we were to take, for example, sleep hygiene, you can go into more in-depth details and explain that maybe you'll aim for 7 to 9 hours of sleep per night. So now you have, something that's more measurable. That's the M. You'll establish a consistent bedtime routine. You'll create a relaxing sleep environment. Talking about nutrition, you'll increase intake of fruits, vegetables, whole grains, in general, healthier food options. You'll limit what's unhealthy, such as processed foods, sugary drinks like sodas. You'll incorporate lean protein into every meal. So now you're coming into more details, and it makes it a little bit easier to follow that goal. Talking about physical activity, you can aim for at least 30 minutes of moderate intensity exercise most days. You can include both cardio and strength training exercises. Find activities that you enjoy to stay motivated. These now, as you can see, you're starting to get a little bit more information with each goal to address the bigger goal of improving your overall health. Next slide, please. And then if we talk about stress management, you can practice relaxation techniques like deep breathing or meditation. So you're being specific about how you will do it and how you will achieve stress management. You can prioritize mindfulness and self-care, seek professional support if needed. Talking about hydration, drink plenty of water, carry a reusable water bottle. And then preventive care, you can schedule annual checkups and screenings. You can stay up to date on vaccinations, monitor vital signs regularly. So all of these examples that we started off with just one or two words, now all of a sudden we have sentences. And I will say that they are still not completely SMART goals. Okay, there are still some parts of the acronym that we're not addressing. So on the next slide, we have an example of what would be a good example of a SMART goal. Here we have the goal is to consistently engage in 30 minutes of moderate intensity exercise, like brisk walking, 5 days a week for the next month, tracking progress with a fitness tracker. So here we target all of the acronym letters, right? So the S for specific, it's very specific. It clearly states what we're doing, which is brisk walking. It clearly indicates the duration, which is 30 minutes, and the frequency, 5 days a week. So now it's very specific. We know exactly what we're going to do. And how are we going to measure this? How are we going to track our progress? With the smartwatch, right? So whether it's an Apple Watch or whatever it is that you can get your hands on, something that you can track your progress. Is it achievable? I would say that this is a reasonably achievable goal for most people, because it's not something that's only for like athletes, professional athletes. It's something that most people can actually achieve. So it's achievable for most people. And again, these should be individualized to you. It's relevant, right? So regular exercise, we all know, is a very important aspect of our overall health. There's a lot of things that go into being a healthy individual, but physical activity is definitely on the top of the list. And then it's time bound. We have a defined time frame. We said the next month. So this is the period of time that we will be tracking our progress. And again, it's not necessarily a deadline, because if we do this, for example, for 3 weeks and we're seeing significant progress, then we can start adjusting our goals. And so that's one of the things that I want to highlight as well on this slide. It's the achievable and the time-bound aspect. Things will change as we go through our goals. So with this example, for example, it's very possible that after a few weeks or after the end of this month, your physique has improved, and you are now at the end of this goal. And it's not that now you don't continue setting new goals. On the contrary, this should be kind of like a stepping stone to improving and continuing your journey of self-improvement. And so your next goal can maybe, you can adjust the specifics, you can adjust the what you're trying to achieve so that it's a little bit more challenging because you've reached that next level. And so something that I think is very important to remember is that every goal is kind of like a step towards further goals and the overall goal of self-improvement, okay? And so on the next slide, please. The next thing that we'll be talking about is discussing with the healthcare team. And so I'd like to kind of just mention some resources and some limitations that we might have, when we're talking about setting goals for ourselves as patients, and how the healthcare system can be of aid, can help us achieve these goals. So the first thing that I want to emphasize is your PCP, your primary care physician. whether your primary care physician is family medicine trained, internal medicine trained, if it's a geriatrician, whoever your PCP is, this is your point of reference and your go-to person, okay? When we talk about resources in the healthcare system. So your primary care physician is going to be the person who will not only help you answer questions, clarify doubts, provide you with resources, but also point you towards the right direction when they don't know how to help you. Because a PCP is a generalist. They don't know all the details of everything, right? So they know a lot of I should say they know a little bit of everything, which means Dr. Solis and I, we will be working as PCPs as well, and we're currently doing that in our training. We try to see the person, the patient that's in front of us, as holistically as possible, so that we can address different parts of their life for their overall improvement. And that is kind of the job of a PCP, is kind of seeing the individual as a whole. Sometimes we need help, right? So we need to refer you to a specialist, and that's the second point, the specialists who are more experienced in certain areas of medicine. So for example, therapists, or if you want to talk about medicine per se, like cardiology and gastroenterology, but kind of focusing on the holistic approach, we can think about specialists also like therapists, for example. So sometimes we'll also be running tests and studies to kind of determine how your overall health is. This could be like monitoring your blood pressure or checking simple blood work like testing for diabetes and cholesterol. And then your other resources, online materials. There's, we live in an age now where everything is basically available, any kind of information that you might be looking for. There's so much available online, and there's a lot of free resources as well. Whether it's information about exercising, about dieting, even therapists. There are free therapy sessions that you can get online, such as zencare.co. The point is that there's a lot of online material that you might not know about per se, but your PCP might, or you might hear about it through friends, such as this platform where we are right now as well, right? So this is an online material that can be very useful for some of you. Now, on the other side, we have kind of recognizing and understanding our limitations. And so time is a very big one. For patients, for example, you might be working very long hours every day. You might not have a lot of time to be able to work on your goals. So that's something to keep in mind when you're creating your SMART goal. It's kind of like that achievable aspect of the SMART goal is you have to make it achievable for yourself. So if you only have 1 or 2 hours per day or 3-4 hours per week, be honest with yourself. What can you actually commit to, right? Realistically speaking. And not only you as the patient, but also the provider. The provider sometimes might not have time. So what I'm referring to is when you go see your PCP, they might only have 15-20 minutes to talk to you. So it's not really their fault. It's unfortunately how the system is. But I would encourage you to kind of prioritize the points that you would like to speak about with your PCP. And that way, if you have your own agenda and you're making an appointment specifically to ask or talk about or ask questions about a specific topic that you are interested in, right? And I really do encourage as well to kind of share your goals with your PCP, because if they do have any resources that they might be able to provide you with, it could go a long way. And money is the other big one. So of course, it limits a lot of things. I will say that you don't need the most expensive, exercise program or diet plan. You just need what works for you. And oftentimes you can find this at a very low cost or sometimes even free. Okay. And then access. So understanding what you have access to. So like I was mentioning before, some of those free therapy sessions that we have online, sometimes it's not that we don't have access to it. It's just we don't even know that they exist. And so that's why, again, being able to create this relationship with your PCP and rely on them for these things is very helpful. And then relevance. So, it might be relevant for an individual to gain 20 pounds, while on the other hand, it's not very relevant. On the other hand, they want to lose 20 pounds. So it has to be relevant to you. Next slide, please. And so some key points in goal setting discussion. This is kind of our perspective as physicians, how we would want an encounter to be with our patient. Okay, so we want to make sure that it's patient-centered. The approach has to be patient-centered. We want to prioritize your perspective, your concerns, because you are the person of interest, right? We want to try to help you. And so understanding your desired outcomes and quality of life, your goals, it has to revolve around you. That's why it's very important, like Dr. Solis was saying, expressing what matters to you, right? So that way we can have that aligned and we can help you achieve those goals. And then we want to have open communication. We like to encourage open discussion. It's a safe area, it's a safe room. We hope that we can make you feel that way, and I hope that your providers do make you feel that way. It's important to talk about the risks, the benefits, the pros and cons of any intervention, whether it's a pill, whether it's an intervention, whether it's a diet, whatever it is. There are pros and cons to everything. And the whole goal is that we are helping you make an informed decision. We are trying to provide you with information, trying to provide you with resources so that you can make what's best for you, right? You can make the decision that's best for you, understanding your options. I think oftentimes we sometimes forget, and what happens is that the physician or the therapist kind of imposes a plan on the patient, but ultimately it is the patient who makes that decision. So it's important to have a very strong relationship with your provider so that you can make those decisions together and that you're on the same page. Next slide, please. So the next key point is collaborative decision making. So that kind of goes hand in hand with this, but it also includes other providers in the healthcare system. So it's not only your PCP, it's kind of reaching out also to those other resources. It could be a nurse, it could be a specialist, it could be a therapist, it could even be patient's family, right? So this is all types of resources that we have that are also forms of support. And that way everyone is on the same page, everyone is aligned. And regular monitoring and adjustment. So again, kind of that measurable part of the acronym. We want follow-up. If we talk about something on this visit, we would like to have a preceding visit in a few weeks or months to ensure that everything is going according to plan. And if there are any changes, if there are any any inconveniences that might have occurred, that we can kind of take a step back, readjust, set some new limits, set some new goals, kind of change what we're doing, little tweaks here and there. And that's the whole point of working together. Patient and provider, strong communication, same page, so that we can achieve the goals that that you're trying to get. Our goals are your goals, right? So next slide, please. And so preventive care kind of is something that we would also like to talk about in today's chat, because it's something that we like to focus on as providers. And it's January 22nd today, so we're 22 days into the year, and it's never too late, right? We're just very much starting the year. So I encourage you all to, if you don't have a primary care physician yet, try to find one. And if you do have one and you haven't seen them in a while, try to see them, because preventive care is something that we should be doing regularly, depending on what your conditions are, what your diagnoses are, your situations. But it's at least every year you should be getting some sort of checkup, and if not more, right? So it depends on your situation. But screenings and tests, what we talk about when we're discussing screenings and tests is kind of it depends on your age and your family history. So some patients will be predisposed to certain things because of family history and genetics, and of course our age. So as we get older, screening becomes more important and maybe a little bit more intense, right, and fortified. So things like making sure that your blood pressure is within the normal range, screening for diabetes, checking your cholesterol. These are easy things that, if are well controlled down the line, can prevent serious complications. And then cancer screenings. So things like mammograms and colonoscopies are very important. And then medication review. Dr. Solis did great, kind of talking about medications as one of the 4 M's. But this is something that's very important because oftentimes it can go missed. But reviewing your current medications, including the doses, the potential interactions, and never forgetting the over-the-counter medications and the supplements. Sometimes we think it's not so important because it's just over-the-counter or it's just a supplement. I don't need a prescription. But oftentimes these can actually have interactions with other medications that you're taking or even certain foods. And so if your provider is aware of these things, it can help your provider make decisions as to which medications you should avoid, which medications would be of most benefit to you. So reviewing medications it should be part of every visit, but sometimes it's not done. So I would encourage you to talk about this with your provider. It's kind of just going over the current medication that you're on. Next slide, please. And then preventive care as well, focuses on identifying areas of improvement. So we talked a lot about lifestyle changes, exercise, diet, kind of trying to improve your overall health and setting strong goals for yourself. This also involves lifestyle habits. So alcohol use, smoking, these are things that many people struggle with, and it's not easy. And kind of referring to what I was mentioning, in the previous slides, there are resources. We have people who specialize and kind of focusing their knowledge and helping people who have certain difficulties letting go of certain habits. Smoking, as we all know, is has a lot of consequences. It can be very bad for our health, but it can be also very difficult to stop. Same with alcohol and other drugs and unhealthy eating habits. So all of these things are very important to also being able to simply identify them. Sometimes we don't even know that they're not good for us, like certain foods. So speaking about them with your primary care physician is a good way of identifying these areas of improvement. Sleeping patterns as well. It's true that as we age, sometimes we need less sleep or more sleep depending on how our body is. But it's always good that if you have any concerns, talk about it with your primary care physician. And then just any concern that you might have in general about your health. And then again, follow-up plan. You see your doctor, you want to have a follow-up. You want to ask, when should I see you again? So that you can touch base, because the same way that you're making goals for yourself, your provider is making goals for you as well in their own mind. So if they're checking an A1C for your diabetes and they're adjusting your medications, they want to see some sort of change in your A1C, hopefully an improvement. And so the plan is that you're going to recheck in a few months. So you want to be on top of that as well and make sure that you're on the same page. That way you're able to discuss and monitor your progress. You're seeing if you're achieving your goals. And then you can make new goals, because if your A1C is very high, but you're able to come down, doesn't mean that that's now, you achieved your goal and you're going to stay there. No, it means that you can continue improving. And so that's the objective. And, you want to continue your overall self-improvement, your overall growth and overall health. Next slide, please.
All right, so I think the next thing we'll talk about is advanced care planning. I think this is a really nice transition from what Dr. Marty Roy was just talking about, because we talked a lot about the 4M so far. Just to summarize, we talked about how we can communicate some of these goals going through the SMART method, and how we can communicate that with the healthcare team. So I think we're done there, right? I wish. Now comes advanced care planning, which is kind of a nice build-up off of that. I think this is really important, how we can document some of these discussions, especially to advanced care planning, and going about that process just to plan for an emergency, which we can talk about next. Next slide. So we want to talk about this point is what's called a healthcare power of attorney. And the question we always come down to is, right now, we can make our own decisions, which is great. However, what I tell patients frequently is, if you cannot make your own healthcare decisions, who will make those for you? And so going to the third point, I'll just skip, sorry. What I tell people is that it's really important to pick somebody that you trust. And I put that in bold, I put that higher, I put it italicized, I put it a little bit bigger font, because that is a really, really key word. Healthcare power of attorney is someone that you choose to be your healthcare decision maker in the event that you cannot make your own healthcare decisions. It must be an adult. And then there's certain things on the form that have to be set in stone so that the process goes smoothly. And I think the key point here I want to make a couple. Number one, this only applies to healthcare decision making. Sometimes I get asked frequently, what about finances? What about property? What about taxes and things like that? And this does not apply here. This is specifically to healthcare decision making. And so if we just stop for a second here, pause. Some of you may already have this form, which is fantastic. I really support everyone having one. If you cannot make your own decisions, who do you trust? Again, emphasis on trust. Because in our experience, we have seen people choose their neighbor. We have seen people choose their brother. We've seen people choose their spouse. We've seen people choose an old friend. Someone that they trust is going to communicate their wishes, their values, their preferences with the healthcare team in the event that I cannot do so myself. And without the form, the state of Illinois decides who that person is. And I think that's really good in providing a framework. At the same time, I would like to think that at the end of the day, we should be deciding who's going to be our healthcare decision maker, because at the end of the day, we know ourselves best. And that's why we really, really advocate for people to have a healthcare power of attorney form. At the same time, I think it's really important that whoever you're discussing this with, as Dr. Marty Roy said, whether it be with the doctor in clinic, whether it be with the doctor in the hospital that you're discussing this with, that you ask a lot of clarification questions and that you make sure that this conversation is documented so that not only do we keep a copy, the healthcare system keeps a copy, whoever you choose to be a healthcare decision maker has a copy, that it's also documented in our healthcare system so that no matter what happens, we can try finding that conversation so that we can align the plan of care with your values, your goals, your preferences. Again, who do you trust? Because you'd be surprised what we've seen in our experiences so far. People will not choose their spouse for one reason or another. And that's okay, as long as you trust that person to be your healthcare decision maker. And lastly, I will say that it's really important, I think we recommend that you discuss with that person that you're choosing so that they know. In our experience, we have also some people decline that role, and it was never discussed between the patient and who they chose as a healthcare decision maker. So we really, really recommend that you have a conversation with that person to let them know, hey, if something happens to me and I cannot make my own healthcare decisions, I trust you to make that decision, those decisions for me, and I would like to reflect that and honor that on a form. So just keep in mind those things when you're discussing this. If you already have one, great. If you don't, I really recommend that you speak about this with your primary care doctor. They can go over the form with you, provide more information. You don't have to fill it out on the spot. It's obviously a big discussion we recommend, and so you can do that. In our experience too, we've had people discuss it in clinic. We talk about the form, they go home, they talk about it with whoever they're going to talk about, and they come back knowing who will be their healthcare decision maker, and we can go over more information with that form on the second visit, going back to the follow-up that Dr. Marty Roy talked about. Next slide, please. This is an example of the form. I just want to put an example just because perhaps some of you have seen this form already. As you can see, it says power of attorney for healthcare. This does not include anything with finances or with property or anything like that. It's just healthcare decision making. You would put your name, your address. I've seen some people not put their address, but usually their address. You put the person's name, their phone number, and then at the bottom it's kind of an individualized decision over when they can start being your healthcare decision maker and their ability to share information between different healthcare systems too. So I just want you to be aware of what this form looks like. This is a newer one. I believe in the past there was an older one. And whatever you do, if you have one, please ask for a copy for yourself, a copy for the person who's going to be your healthcare decision maker. Make sure that we have a system or a copy in our file. And again, that conversation is documented, just so that we're all on the same page. There's no misinterpretations or anything like that. So again, healthcare power of attorney, I recommend everybody have one. have that conversation now before it's too late and we're left scrambling over who's going to make what decision. As we talked about earlier, prevention is very important. So we want to prevent any, hopefully prevent any kind of crisis decision making. Next slide, please. So like I said earlier, without the forum, the state of Illinois decides who makes decisions on your behalf. And it really goes in this order. So a guardian, if that applies, then it goes to a legal spouse. So I make sure I say legally married. Sometimes what I'll ask patients if they are legally married, just so that it's documented there that they are legally married. And then as you can go, I won't go through everyone, but as you can see, it goes to adult children, and then your parents, adult siblings, adult grandchildren, etc., etc. Something I do want to point out here is that when there's more than one person that applies, so for example, if someone does not have a healthcare power of attorney form and they are not married or they are widowed or they are legally divorced, and it goes to adult children. If there are more than one, each child has equal decision making, which can be really tricky, and not always, but it can be really tricky and a really sticky situation. In our experience, some people feel very strongly about not having all their children be their healthcare power of attorney for whatever reason. They prefer having one or two people be that decision maker. And that's why we really want to emphasize having that discussion so that we all know who's going to be that decision maker and that it's not someone that you do not trust for whatever reason. Next slide, please. And then here, briefly, we'll talk about what's called a POST. It has different names. Here, it's known as Petitioner Order for Life-Sustaining Treatment. It is a voluntary form, meaning that you do not have to fill this out. However, what I will say is that some people in our experience feel very strongly about how they would like to be cared for if they became very sick or if their death was approaching. And so depending on those discussions, depending on those values, depending on those preferences, this form can be documented. I'm sorry, these decisions, these preferences can be documented on such a form that really provides instructions to us as a healthcare team on what to do in the event of your death. Like I said, some people feel very strongly about it. Oftentimes, this comes up when we're also talking about healthcare power of attorney form. We do recommend that you fill it out if you prefer allowing for a natural death. If you do not want, a healthcare team to attempt resuscitation, if you do not want breathing tubes, I do recommend that you fill out a form so that it's filled out, and to make sure that we honor those wishes. We, in our experience, we very well recognize and acknowledge that such conversations are very difficult. These are things that, like kind of with the healthcare power of attorney, we do not want to make these decisions on the spot with a lot of pressure when things are not going so well. These are discussions that happen over time. And I think sometimes, a lot of times, there's overlap between these discussions of healthcare power of attorney, as well as this POST form that we're talking about. And so, like I said, it's a voluntary form. If you feel very strongly, we can take a look really quickly at an example. We do recommend that you talk to your PCP, primary care doctor, about it, and have that discussion early on about what that looks like. And I think something I encourage everybody is how you like to be cared for. To think about how would you like to be cared for if you became very sick, if your death was approaching. How do you imagine being cared for at that time? And like I said, we fully acknowledge and recognize that these can be difficult conversations to have, and very scary too, right? We acknowledge that. And the hope is that if we have these conversations early, we talk about making recommendations based on your values, based on your preferences, based on what's important to you, hint, what matters to you as well, just to bring it back, that we can talk about this in a way that's really making recommendations based on what's important to you and based on your values and preferences. Next slide. So this is just what the form looks like. As you can see, there's two parts. I just cut off the name and the bottom part of the signature. This is a part where we talk about directions for us as a healthcare team on what to do if you have died, and what to do, as well as in regards to breathing tubes. Like I said, some people in our experiences feel very strongly about one way or another, or maybe even a little bit of a nuanced conversation about that. And in our experience, if you feel very strongly about allowing for a natural death, and not having chest compressions and allowing, do not attempting resuscitation and not having the breathing tubes, I do recommend that you talk about this with your doctor for more information too. Next slide. That was it. That was our presentation on what matters. We kind of talked a little bit about different things. Hopefully this was informative, like I said, and hopefully we've given you some thoughts and comments to talk about with your doctor about, because we feel very strongly that prevention is very important, and having these conversations earlier on is very important, so that we can make sure that you are being cared for in a manner that you are okay with, that's in line with your values, with your goals, with your preferences.
Absolutely. I agree. Very thorough presentation. Thank you so much, Dr. Solis and Dr. Marty Roy, for this thorough information. And I'm glad that you started with the goals, because of course there are some goals that are more immediate in terms of how to remain healthy so that we can engage in everything that matters most to us. And also the goals that probably can be long-term or for later in life, but equally important for us. But and also I wanted to point out that, speaking about those 4 M's is so important, because then we are giving people information about what are those evidence-based components of age-friendly health systems. Rashida is designated age-friendly health system, but there are others in the nation that are not. So since this goes beyond our region, sometimes these lectures, it's important to still give people that information so that they can probably advocate and make sure that, are we discussing the medications, or how is it that I'm my mobility? What are some of the things that I'm doing so that I can remain as mobile as possible, because then that helps us to remain connected to others and things like that. So Franco, if you wouldn't mind, then as we transition into Q&A, just taking down the slideshow, that'd be great. Thank you. We always give our callers a chance to unmute and ask questions. Let's see. Otherwise, I have quite a few already for you. Let's see. Any questions from callers? All right. Oh, yes. Thank you. Reminding me that *6 to unmute. *6, you will be able to unmute. Our callers usually know that better than me, but it seems that we're okay. I think we can transition into the other questions that we got. One that is about the mammograms. One of you mentioned some of the screenings that are important. Are those required throughout a woman's lifetime, or are these aren't required after a certain age?
That's a great question. So it will depend on family history. It will depend on your age, on your risk factors. So it's a little bit hard for me to say something because it really does depend on your situation. So when it comes to screening, even with colonoscopies, for example, we do have set guidelines that is for the general consent, I would say, but we do individualize even these, I guess these guidelines, we individualize them to our patients because things can change. So for example, if you have, if you're a 45-year-old male, you technically need a colonoscopy. However, if you have family history of colon cancer and they were diagnosed at a younger age, then you should probably get screened earlier. So all of these things are very important to take into account. And that's why it's important to talk about these with your primary care physician, your concerns, history of cancers, risk factors, because they will be able to look at your at your case holistically and kind of take everything into consideration to make sure that the recommendation that they're giving you is the appropriate one.
Thank you. That makes sense. That makes sense. Family history is key. Also, since we, this came later, but since we just spoke about it, the power of attorney form, our understanding is that it can be changed. This is not permanent, but the question is if it's good for life, or can it be changed if the person that the patient chooses is no longer available?
Yes, that's a good question. The form can be changed. By that, I would say you should redo the form. And just to add maybe a little bit more detail, you can pick up to 3 people. So that's the first person you choose, and then you can pick a second person and a third person after that. However, if for whatever reason you like to change who you would like to be your healthcare power of attorney, given our conversation about really emphasizing who you trust, we acknowledge things can happen. For whatever reason you want to choose a different person, I would redo the form, making sure that you have the most updated form up to date, making sure that your healthcare power of attorney form, your designated healthcare power of attorney has the most updated form, making sure that the healthcare system has the most updated form, and also making sure that a new conversation is had and documented as to about this change. I would say too, just very briefly, we want to make sure that there's clear directions on what happened so that everybody knows that there's a new healthcare power of attorney to honor your wishes.
Thank you. And actually kind of related to that, one of the questions is about third-party DNA genetic testing. Is it suggested to know our family lineage and find out about potential health problems? Sometimes we don't know about our family medical history because at times probably there are things that were never diagnosed.
So those are tests that are usually very costly, and probably it would be without a reason to just go and get it done, it would be hard to convince your insurance to cover it or your PCP to even order it. What happens sometimes is if you're presenting with certain symptoms that your primary care doctor or specialist is thinking about, maybe there might be some sort of genetic component to your symptoms, maybe we should go ahead and screen you, then that's a different conversation. But testing everyone for genetic predispositions is not something that we routinely do because of its price and the lack of efficiency, really. If most likely than not, it won't be the answer. And so we try to save these exams or these tests for patients that actually have some sort of reason to have them done.
Thanks. Another question, you mentioned online materials. What good resources will you suggest, and how do we avoid misinformation?
That's a great question. Misinformation is a big issue nowadays. So the internet is full of resources. You do have to be careful what you read. You can, for example, YouTube, where we're streaming this right now, is an excellent resource because pretty much anyone can upload. And so again, you do have to be careful, but it does allow you to have access to to talks like this one and all the other ones on this channel. I mentioned a few other resources for specifically therapists, like psychologists, that I think is important. Sometimes mental health is still not spoken enough about, and so one that we often recommend our patients who are unable to see a psychologist in time, because there is a long waiting time, is zencare.co. It's a resource it's a free resource with therapists and psychologists, and then the other one is psychologytoday.com. These are 2 websites that I've used through residency and through fellowship that my patients have been able to take advantage of, just because it is hard to get in and see a psychologist within a short time frame. So that waiting time is long, and sometimes it's better to be seen sooner than later.
Excellent, excellent. Thank you so much. I think I wanted to also point out, when you mentioned that things change when you were talking about the goals, that is important for everyone to recognize, to accept, and then also to recognize that it is okay to modify our goals.
Most
Sometimes what we're doing is not working, then we just shift and try something new.
Exactly. Whether it's because you achieved your goal and now you need a new one, or because something happened in your life and now it's no longer achievable for you, and then therefore got to take a step back and adjust the acronyms for them to fit your new situation.
Yeah. And the difference between those goals or objectives, and then how is it that you need to break it into action steps, which is where the SMART is very helpful. Maybe 1 week is increasing the intake of water, like to 4 bottles, or 2 in the morning and 2 later, so being as specific as possible. So thank you so much. Thank you for this. We are approaching our end. We greatly appreciate it. And I actually want to expand. You talked about optimizing your resources. We have, of course, primary care physicians and other providers, online materials, but you also have Rush Generations here for you to help you in staying healthy. And also, like Dr. Solis and Dr. Marty Roy said, you are at the center of your care. So you have to be as informed as possible and equipped with many tools as possible, so that you can also contribute to the care that they are trying to provide for us. So thank you so much. Right now, let me see. We have some exciting programs coming up, starting with, let's see, what do we have first? Oh, Art for Emotional Wellness. We are talking about emotional well-being and mental health. And this is a free 6-week wellness class that incorporates various forms of art and expression to foster emotional wellness. This program is designed and implemented by arts in healthcare students at Columbia College Chicago. We've had this partnership for years, and the students, for their senior capstone project, they come to Rush to provide this. So therefore, the topics and the mediums are going to change from year to year, but they can include fine art, dance and movement, music, improv, poetry, and others. So we hope that you join us. We have some spots left. It's going to be in person. This is not virtual. And it will be offered here at our main Rush campus, Rush University Medical Center, starting on February 25th. From April 1st to, from February 25th to April 1st. That makes more sense. So call us, 1-800-757-0202. Let's see. And as always, we want to hear from you. We want to learn from you. The doctor spoke about what matters. So what is it that matters most to you? The Shulman Senior Voices, the Shulman Senior Voices program aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your loved ones, with your physicians. And when you record a mini video of this, you always get a copy. We want to hear from you. If this topic also was important to you, what pieces would you like us to expand on throughout the year? So consider sharing your wisdom and why it is important for your healthcare team and your loved ones to know your goals and your wishes and what matters most to you. I think that this lecture gave you tons of reflection to speak more about what matters most to you. And this is a unique opportunity for you to record a video that then you can get a copy and then you can share with others. And lastly, our next lecture, it's very soon. It's Understanding Cardiovascular Disease, and it's going to be on February 5th. 2025. You know the drill, usually on Wednesday at 1 p.m. So we'll be here for you, and we look forward to welcoming the providers and welcoming you to discuss this important topic. Other than that, we are always here for you. Feel free to call our toll-free number 1-800-757-0202, and we will direct you to any additional programs that we offer within the Department of Social Work and Community Health here at Rush University Medical Center. Once again, thank you, Dr. Solis. Thank you, Dr. Marty Roy, for your presentation, and in particular for Dr. Guranti and the senior care for always collaborating with us on these lectures, Shulman Senior Voices lectures, to explore the different aspects of age-friendly health system. Thank you so much, and until